Hello, good evening, everybody. Welcome to our Tuesday evening, our technical Tuesday evening. And last week we started a new topic, and that is the topic of ADHD. And I chose that because October is ADHD Awareness Month, and it definitely seems to be a lot more prevalent these days. We covered depression before then, and last week we started ADHD. And sadly, it seems the two tend to go hand in hand quite often. So we covered a little bit of the basics last week about what it is and how it works and all the rest. And we'll carry on this week. See. Sorry, I was editing this earlier. So, oops. So the question is having ADHD an advantage or disadvantage? And we ended up last week with some of the advantages about what makes it good and what makes it tolerable. This week, we're going to start off with the management of it. How do we manage ADHD? Do you simply go along and you're a little bit fidgety, so you go to your GP and he says, oh yeah, you're a bit fidgety, you're not focusing too well, you must have ADHD, here, have some medication? Or are there alternatives? First line is non-medication measures. You don't want to use drugs if you can at all help it, unless they are moderate to severe symptoms and impairment. So obviously there's different rates or steps or sections of how bad your ADHD is, because as we know, we get ADD, which is attention deficit disorder, and then there's the attention deficit hyperactivity disorder as well, which is, in my opinion, probably slightly a bit worse because they're fidgeting and they can't focus and they're moving all the time. And I'm sure it gets pretty exhausting. So the first thing is a parent training program called Barnardo's and behavioral management. So you start with the least invasive form of treatment. And then you train them on attention. How do they stay focused? How do they get their mind there and not be herding cats or geese or go juggling 56 balls at the same time? Because that's pretty much what ADHD is like. And then there are certain behavioral programs at school. This ADHD is not just a school thing, and it's not just an at-home thing. It's a life thing because it affects you at home, at school, and in public. So a lot of this information came from this textbook of child and adolescent mental health. So if you want to look at this slide again later, just to get an idea of where all the information came from, please feel free to check out the website over here. But now we're going to focus on some of the non-pharmacological treatments for ADHD. As we said, we want to stay away from medication as much as possible for as long as possible. So what are the basics? And are there more than one treatment? So we talk about multimodal treatments, as well as dietary treatments. And this includes excluding artificial colors and preservatives. And I've covered this in the past, why it is so very, very important to read labels. Unless you pick it out of your garden, if you buy it in the shop, it has a list of ingredients and it has a nutrient value chart on every single product that you purchase. including things like milk or butter or even honey. Learn to read those labels. Now, if you have an ethical company that puts everything on the label that it needs to put on, that's great. And it gives you a fighting chance to get a better idea of exactly what's in that product. Obviously, they're not going to put down the exact recipe, but they do need to put down what's in there. Now, sadly, in the case of certain medications, in the case of certain supplements, and even in the case of food, there are a lot of things that are not mentioned. There's restrictive elimination, or one needs to look at restrictive elimination diets, oligoantigenic diets, which is the removal of common allergen foods. So you start with a very, very bland diet. You take out everything and anything that could possibly be causing a problem. And you supplement with omega-3 fatty acids. You supplement with vitamins and micronutrients. So a good multivitamin and multimineral. Then there are the psychosocial treatments, behavioral interventions, the cognitive training, the neurofeedback. Now, these are all psychological type treatments. So you need somebody who is trained in this area. And usually, if it's not a behavioral therapist or psychologist, it'll be somebody like an occupational therapist that will give you or be able to assist you with a lot of these treatments. So medication, as you know, I'm not a big fan of medication, but it has its uses, and we'll never rule out medication altogether. The trouble is it's too easily prescribed, and that's what we need to rule out. It is effective in short and medium term for core symptoms, for comorbidities, for daily functioning, to decrease neuropsychological impairment, executive functions, executive and non-executive memory, reaction time variability, response inhibition, and aversion to delayed reward. So it does help in some cases to focus their attention. And there's also intrinsic motivation. But what are the cons? Partial or no response in a proportion of cases. So you can prescribe your medication, but if the child or adult doesn't respond, you're wasting your time and money. And like with all medication, there are adverse effects. And one needs to check and see what are the side effects. There are questionable long-term benefits and costs. And maybe I'm wrong, I'm not a medical doctor, but in my opinion, chronic medication isn't always a good thing. Because again, my opinion, if you have an issue, regardless of what the issue is, there has to be a cause. And the cause generally is not a lack of a medication. It's usually too many chemical additives or a lack of a nutrient. The key here is to find out what that missing thing is. Often there's poor adherence to the medication because of the nasty side effects. There are negative attitudes, preferences of patients, parents, or clinician to medication. So what are some of the drawbacks of non-medication treatment? There's methodological problems with evidence because sadly, to do research costs a lot of money. If you cannot patent the end result and therefore earn your money back, you're not going to be earning any cash out of it. Because when the pharmaceutical companies do the intensive research, they are plowing millions and millions and millions of dollars into research. Therefore, when they get a product that they say works and they launch it, they're going to charge a significant amount in order to recoup those investment into the research. Now, if it's food, if it's a supplement, you probably are not going to be able to recoup that investment because you can't patent food. You can't patent fish. It's there, it's freely available. So in order to get the results in the way that medical people want the results, it's going to cost a small fortune. In some cases, quite a large fortune. And the chances of you recouping that money back again is not always that good. So that's where the evidence-based problems come about. There are non-randomized designs because the best type of research is random research. There are not a lot of non-ADHD samples. There's not a lot of non-ADHD outcomes because if the person doesn't have it, well, what is your research going to prove? It doesn't allow firm conclusions. And the recommendation for use is not implied in this chapter. So some of the food issues, artificial food colors and preservatives, otherwise known as the Feingold diet, as we know, if food or food-like substances are processed, often the raw ingredients give off a funny smell or a funny taste, or they just look bland. There's no color to them. So in order to make it look attractive, I mean, after all, who's going to want to eat some pale white glop where if it's bright red, it smells good, it tastes good, people are going to be more willing to eat it. So in order to get those colors, those flavors, those smells, they've got to put in chemicals. And in order to keep the food or the food-like substance on the shelf for a longer period, because obviously you're not going to make a lot of money if you've gone to all the trouble of processing it, put it on the shelf, but it goes off within 24 to 48 hours. You're never going to make any money that way because what are the shopkeeper going to do? If they haven't sold it, they're going to chuck it away. And if they chuck it away, nobody's buying it. And if nobody's buying it, where do you get your money from? So they put preservatives into these foods. And some of the preservative abbreviations, because they're never going to put the big names, because as we know, fine print, there's not a lot of space for that fine print. So they put down things like BHA, or they'll just use an E number, BHT, another E number, and TBHQ. I challenge you, go and look at the products in boxes in your cupboard and see if you can identify any of these preservatives in those products, whether it's the full name, whether it's the abbreviation, or whether it's the E number. And the E numbers are very confusing because, well, they all look alike. E320, E319. Who are we to know what the difference is? Unless you're being very diligent and going along and doing a Google search to check and see what it is. So foods first eliminated and then tolerance tested in order to see what is causing a problem. You need to get rid of anything that's got artificial colors. Read the label. Artificial flavors and fragrances. The three preservatives, BHA, BHT, and TBHQ. Artificial sweeteners. Foods and products with salicylates. And you'll be surprised how many products actually have all of these things in them. So in other words, you need to get rid of virtually all processed foods. By doing this, they discovered that a small effect size was reported by parents. There, unfortunately, was limited scientific evidence, but it may be useful as an adjunctive treatment, not as a main treatment, but it's a good start. Restrictive elimination or oligo-antigenic diets, which means the same thing basically. Foods, a focus on elimination of foods that may act as antigens or allergens. Things like cow's milk, cheese, eggs, chocolates, nuts. Yes, all of these can be allergens. Do a temporary 2 to 5 week change of diet to only the hypoallergenic foods. Things like rice, turkey, pears, lettuce, and water. So in most cases, they say that these are hypoallergenic, meaning that there are no known allergies to these things, or no published allergies to these. And then you follow this by 12 to 18 month reintroduction phase. And by doing that, you are simply, you've taken out pretty much everything that is artificial, and you slowly but surely start to phase things in. Read the label, do yourself a favor, keep a food diary. Today I had product name. This was the result afterwards. I felt weak, I felt hyper, I felt whatever, or I felt normal. This is a good thing. And you do that for 2 or 3 days because there can be a buildup, and then you phase the next thing in. And so you go, and this is why it can take 12 to 18 months to reintroduce all the foods to find out which one is the problem child. And as I often say to my patients, when you go to a doctor and you say, listen, I've got a problem. If it's an orthopedic issue, you've got a broken leg or a broken arm, it's easy to figure it out. You take an x-ray, you can see the break, and you know how to fix it. But if it's a medical problem, the doctor has a little bit more of a challenge to figure out what the problem is. Because first of all, he's got to figure out what the problem isn't before he can figure out what the problem is. Based on IgG-mediated ADHD theory, there's consistent evidence that is lacking. So it's not always easy through these diets. And it might be a good idea to work with a dietitian at this stage as well. So we spoke already about the fatty acid supplementation. Omega-3s, in my opinion, are probably one of the best ones out there. Alpha-linolenic, or ALA, omega-3, and linolenic, omega-6, are acquired only through diet. Your body cannot produce them. You can only get them through your diet. They are important in structure and function of the neuronal cell membranes in the brain, the retina, and myelin sheath. And this is why it is so important, in my opinion, that moms or moms-to-be should start to supplement with a good, clean omega-3 supplement from before conception right the way through pregnancy and until the day that they stop breastfeeding. I would recommend that they continue anyway, but for baby's sake and for the child's sake, it is vital to have a good, clean and I say clean because you want to make sure that there are no chemicals in it, omega-3, because it is so very important for the brain, the retina, and the myelin sheath, which is what you find around nerves. There are much lower concentrations of omega-3 in ADHD children. There are varying results that were discovered in 3 meta-analyses. 2 were positive, 1 wasn't. And again, these sort of analysis they're subject to numbers, and it all depends on a huge number of variable factors. But there is unclear clinical relevance possible as an add-on for the amounts of the omegas to take. But they recommend between 300 to 600 milligrams per day of omega-3 and 30 to 60 milligrams per day of omega-6. Now, a good balanced diet should get this to you. But where do you get the omega-3? The best source is fish. How many people eat good, healthy, uncontaminated, cold water fish on a daily basis? The minor side effects that you get from this is that fishy taste or the odor. I call it an echo. A stomach upset, especially if you've got a sensitive stomach and you take it without food. If you take too much, you can develop loose stools or even nausea. And that would be if the capsule dissolved, I would say, pretty close to the top of your throat or your mouth, and you have this intense fishy taste, which could lead to that feeling of nausea. So some of the micronutrient supplementation that you need to look at. Vitamins and minerals necessary for enzyme function in neurotransmitter metabolism. So you start with a multivitamin and mineral because you don't know what your body actually needs and how much of each thing it needs. So think of a multivitamin and mineral like a grocery store. You don't walk in and take every single item off the shelf because you're never going to use all of those things. You go along and I need 1 box of this, and I need 2 packets of that, and I need 3 packets of this, and no, I don't need that at all. Yeah, I think I need a little bit of that. Maybe about just 1 little sachet of that. I don't need to buy it in bulk. And you walk out. You can walk out with a handful of things. You can walk out with a trolley full of things. It really depends what you need at that time. So by giving your body a multivitamin and mineral with the enzymes, your body can pick and choose exactly what it needs, how much it needs, when it needs it, and just like your groceries, when you get home, after you've taken things out of the box and you've used them, what do you do with the packaging? You get rid of it. Same deal with the vitamins and minerals in our body. What your body doesn't use, it gets rid of. ADHD may be associated with related metabolic dysfunction, meaning that your body is not able to metabolize what you're putting into it. There's modest to negligible effects in trials with things like iron, magnesium, and zinc. There's better evidence for broad-spectrum vitamin mineral treatment in ADHD. There is no clear data for specific dose and ingredients. High doses could be toxic. So be very, very careful. And again, my opinion, work with somebody who is knowledgeable about supplements. Speak to a clinical nutritionist, speak to a dietitian, speak to somebody who has experience. So just in summary for the dietary interventions, restricted elimination diets may be beneficial, but larger scale studies are needed on unselected children using blind assessment and including assessment of long-term outcome. And when they talk about that, they don't talk about a couple of days, a couple of weeks. They're talking about pretty much from diagnosis of ADHD until adulthood. So many, many years in some cases. And in some cases, even for the life of that individual. Artificial food calorie elimination is a potentially valuable treatment, but its effect size is small and it is uncertain which children may benefit from it. So try it, don't try it. Again, my opinion, try it because you've got nothing to lose. It may make a difference, it may not, but you won't know until you try to eliminate it. There is evidence from well-conducted studies for a small effect of supplementation with fatty acids, meaning the omega-3s. So some psychosocial treatments or behavioral interventions. These are delivered by therapists, parents, and teachers. They're aimed mostly at preschool and primary school age. Basic operant conditioning model, praise for positive and ignoring negative. And just exactly like you would train a puppy or a pet of some sort, you praise the positive, you ignore the negative. This is exactly how they advised to train a child. Don't beat the daylights out of them. It's not going to do anything. But look for the good. And this works in all situations. In our work from phone business, in normal business, brick and mortar business, in school, in general interaction. If you look for what is positive and you praise it and encourage it, you will get more of that. You're going to enhance enjoyable parenting and positive parent-child interaction. There should be a daily report card from school to home and back. As I said, this is not just an at-school issue or an at-home issue. It's an at-life issue. Increase structure, so you give clear instructions, one at a time, and review the daily plan. Don't tell them, go there, pick up this, then go there, drop it down there, then go over there and put something that you found at the second part down at the third part. They're going to have lost you at the go there. Tell them to go there and pick up that item. And then once they've picked it up, you say, right, now you take that item and you go and you do the next thing. Keep the instructions clear and one at a time. Skill building in school or clinic takes planning, organizing, social interaction, and this includes adolescents, not just children. Cognitive interventions for negative schemes or thoughts, especially adolescents, and individual versus group-based parent training. Because no two people are the same, one should treat each child differently. And I'm going to stop there right now because I've only got about 5 minutes left. So let me stop sharing. Does anybody have any questions or comments before I stop recording?